Hello, everyone. Well, we are talking about the superfoods of superfoods called adaptogenic herbs. We have in our studio today Dr. Sweet. Dr. Sweet is a naturopathic doctor and an Ayurveda practitioner. She blends the two therapies together to help her clients in a holistic way. Welcome, Dr. Sweet.
Thank you so much. It's so great to be here.
Great, welcome. So let's just understand the term adaptogen. What exactly does it mean?
So, adaptogens are really herbs or foods that help us adapt to stress. And that can be physical stress, mental stress, emotional stress. And so that's kind of where that term comes from. And in Ayurveda, there's a similar concept, and we call these substances rasayanas, which are rejuvenative tonics.
Yes, I have heard about rasayanas. So let's just talk about the common adaptogenic foods first, and then we'll go on to the herbs after that.
Great. So when I think about food as adaptogenic, I think about eating the rainbow. So when we think about the substances that make plants or foods a different color, bright colors, they have antioxidants in them, and those help our bodies fight free radicals, which could be considered something that happens when we're exposed to stress. And then there are a lot of foods in Ayurvedic medicine that are adaptogenic. One of my favorites is amla, and it's a small sour fruit, high in vitamin C. So that really helps support our immune system and our adrenal glands, which are, of course, responsible for releasing cortisol and epinephrine and all of that when we're under stress.
So what kind of compound does the amla or Indian gooseberry, right? What does it have to help us get rid of stress?
So it has a variety of constituents, actually a long list. I'd be happy to provide some research about all the different bioactive constituents for amla, but simply the one that most people are going to be familiar with is the compound vitamin C, and that helps to battle stress, cortisol. It helps our adrenal glands, and then it also is going to be one of those antioxidants, so combating free radicals.
Sure. So what other, could you name, like, would turmeric be considered as an adaptogenic herbs, like reishi mushrooms? What about those kind of foods?
Absolutely. So a lot of mushrooms are considered adaptogenic. We know that these mushrooms help our natural killer cells in the immune system. They help scavenge for unhealthy dividing cells, so cancer. They help our brain, so nootropic. And turmeric, of course, it's very well known for anti-inflammatory properties, but it is an adaptogenic herb. So we know turmeric, there's so much research out there. It helps us stabilize blood sugar. It's not only helpful for stimulating the immune system, like if you're fighting infection, but when we use it on a daily basis, it's actually an immune modulator. And why that's important is because sometimes when people have autoimmune disease, we don't necessarily want to stimulate the immune system. We want to help it re-regulate. So sometimes that's actually down-regulating immune cells that have kind of gone haywire. And so not only, anti-inflammatory, but immune modulating, regulating blood sugar. And so it's just one of those awesome herbs that is definitely an adaptogen.
So how should you consume it? Like, should we consume it in a kind of as a supplement with a higher dose, or just put it in the curries, like a lot of Indian curries are, or like a root? What is the best way?
So it kind of depends on what your body needs as an individual. And that's why it is helpful to work with someone who can kind of look at the big picture and figure out, how you should dose it. But obviously in India, they have it figured out and they use it on a regular basis. And I think That's the biggest thing with adaptogenic substances is it's not a quick fix. It's not a just take this pill and you're going to get better right away. These are daily tonics that we can put in food or our food that help us, and you see the changes over a longer period of time. So I do love potent, supplements if we're really trying to target something acutely. But the best thing you can do is food as medicine and integrate it on a daily basis and use it in that preventative way so that you're really giving your body a tonic and a daily support for all the things we're facing in the world.
Sure, sure. You did mention about the rasayana, in Ayurveda, they use the term rasayana, which is the same thing as adaptogen, what you're talking about. So besides Indian gooseberry and turmeric, what are the other what are the other foods or Ayurvedic herbs that are considered as rasayana?
Yeah, so there's quite a bit, but one of the ones that might be familiar with to a lot of people is tulsi, which is holy basil. Mm-hmm. And so, it's in the basil family, it's spiced, and it can be very helpful if taken on a daily basis for immune support, for stress response. Some of my other favorites are actually in the asparagus family. So we can think about these as food, and that is Shatavari or asparagus racemosus, and then saw-fed muesli. And so Shatavari is very helpful for women's health, for fertility, for lactation, and very helpful for kind of decreasing that stress response so that we can have a libido. And saw-fed muesli is kind of the same thing for males, but they can also be used interchangeably between the sexes. And then the other herbs I would think about, like moringa, which is really helpful for blood sugar, and also helps with lactation. There are quite a few. Ashwagandha, of course, is a very well-known herb for being an adaptogenic herb, and one that I personally took before I got pregnant recently. And now that I have had my baby, it is back on board for sure.
So that's quite a big list from an Ayurveda herb point of view, right? So you mentioned about Shatavari, and there's a lot of research on Shatavari as well for women's health. My question is it safe for us, like consumers, to take these herbs without consultation or not? And if yes, what is the dosage?
So I think that it's important to have an individualized plan for every patient. And, there are some very safe food as medicine herbs. Even black pepper can be considered medicine because it helps to stabilize blood sugar. So if you're doing these herbs as tea or food, you're probably not going to be having a dose that's going to be doing harm. But these are very potent, and there is a vitality in these herbs. And the beauty is the vitality of these herbs can speak to our vitality as an individual and know what we need. So I don't want to discourage people from playing around and trying these things, but if you have a health condition, or maybe you're, wanting to get pregnant, or you are pregnant, or you're on pharmaceutical medications, it can be very important to talk to a healthcare professional, because something even as benign as turmeric can be contraindicated if you're on blood thinners. And so we just want to make sure that these herbs that are very powerful and very potent and very helpful in the right situation are being used appropriately for the individual.
Sure. And we have a comment. Someone's commented, turmeric is very beneficial. Great that you are highlighting the benefits, and also best to use, incorporate for immune support. Do you want to comment on that?
Am I able to see the comment, or let's see?
Right here, yes. It's right here. You can see it now.
Okay. Yeah, so if it kind of depends on how you want to support your immune system. If you're using it on a daily basis, you're kind of combating free radicals and stress that could be affecting your ability to fight infection. If you're, if there's over inflammation in the body, then you're going to need higher doses, maybe 500 milligrams twice a day. It also depends on the extraction method and the potency of these herbs. And so that's something to look at from supplement to supplement. If you're having an acute infection, then you're going to want to increase the dose for a shorter period of time. So I hope I answered that to the best of my ability without, knowing specifics on kind of what the target goal is.
Sure. No, I think you did a great job. Any other comment or feedback from that comment that Maria had? You're welcome to put it in the chat window again, and we'll take care of it. So what you're saying, what I understand is it's okay to use these adaptogenic herbs as food as medicine. We sprinkle it every day on the food and take it on a daily basis. But if someone has any health ailment or concerns, then consult a doctor or consult a physician like yourself, so that it doesn't it doesn't interfere with any other issues or any of the medication that you might be taking, right?
Absolutely. And then to have the plant be able to work to the best of its ability, dosage is important. So when you work with a practitioner, you might end up receiving a higher dose as a prescription, so that we can really target what's needed. And so that, I think, is important to know the safety of those. And then every supplement is very different. And turmeric, for instance, there's a lot of supplements on the market that are curcumin, and that comes from turmeric, but it's just a very specific constituent. There's other constituents in turmeric that are beneficial, and that wisdom of the whole plant medicine, I think, so educating people around that is a lot of what I do. And we look at what they're taking, and are there any additives or preservatives or things that are in there that maybe the body doesn't need to get the best benefit of the herb.
Sure. Well, thank you so much, Dr. Sweet, for being with us. We just wanted to do a quick intro, like a 10-minute intro on what adaptogen means and what adaptogenic herbs are, and what is it that you can do safely by yourself, and where you need, intervention from an expert. Anything else you'd like to add before we wrap up today?
The research is out there on these herbs, but I would say that the beauty of adaptogens is that there is vitality in you, and there's a vitality in these plants, and they really work together in a very synergistic way to optimize health. And so I'm very passionate about adaptogens and rasayanas, and thank you so much for having me.
Absolutely. And then the message for this session is just learn about adaptogens. There are a lot of interesting adaptogenic herbs that can help us on a day-to-day basis, and invest in your health. That's what we are doing every single day. We're bringing you 10 minutes of wellness, just not advice, I would say wellness tips that you can do on a daily basis from an expert. And this is not a medical advice. This is just an educational session. That's right. That's what I want to add. Thank you so much again, Dr. Sweet, for being with us.
Thank you so much.